the reason for the public debate is because this government did something that the last government, and this is a programme that's been going for 25 years, did not do, which is we said if we're going to use anonymised data for the benefit of scientific discovery in the NHS, people should have the right to opt out. We introduced that right and we sent a leaflet to every house in the country, and it's very important that we have that debate. Well, he complains about it, Mr. Speaker, but he didn't want to give him that right to opt out when he was Health Secretary.
Sarah Wollaston.
Mr. Speaker, the Secretary of State will be aware of the report in the Telegraph setting out how hospital episode statistics data was sold to insurance companies, and they were able to match that with credit ratings data. Nothing will undermine this project more, this valuable project, than a belief that data will be sold to insurance companies. Will the Secretary of State set out how he will investigate how that was allowed to happen and categorically reassure the House that there will be no sale of care data to insurance companies?
I am happy to give that assurance, and she is absolutely right to raise that issue. That, incidentally, is one of the reasons why, in the teeth of opposition from the party opposite, we set up the Health and Social Care Information Centre as part of the Health and Social Care Act that they opposed, because under the new Health and Social Care Information Centre, there are guidelines in place that mean that that could not happen. And she's also right to say that it's very important that we give the public the reassurance that they need, because this is a very important programme. Let's not forget, this is the programme over many years that identified the link between thalidomide and birth defects, identified there was no link between MMR and autism, and helped identify the link between smoking and cancer. And it's absolutely vital that we get it right.
Mr. Crosby.
Virtually everyone wants to improve patient care within the NHS. So why not scrap the underhand way that the Care Data programme has been progressed so far? Provide instead a diverse choice of ways to opt in, limiting the use of medical data to the NHS, and keep the public's personal information out of the hands of the private sector.
Can I gently tell the honourable gentleman that the reason that we're having this debate is because this government decided that people should be able to opt out of their anonymised data being used for the purposes of scientific research, which his government refused to do. When they extended this programme to outpatient data in 2003 and A&E data in 2008, at no point did they decide to give people the right to opt out. We have introduced that, and that's why we're having this debate.
Ian Huppert.
Thank you, Mr. Speaker. There are, of course, huge benefits to using properly anonymised data for research of great benefit to people. But it is hard to anonymise it properly, and there is a huge risk to public confidence given the way the scheme has gone so far. Will the Secretary of State make sure to use this current pause to work with the Information Commissioner to make sure that it is properly anonymised and people can have confidence in how their data will be used and how they can opt out?
I will absolutely do that, and that's why NHS England was absolutely right to have the pause so that we can make sure that we give that reassurance. And I think the point about, well, we had a pause before, and the result was that we got a very good Health and Social Care Act, which is doing very good things for patients throughout the NHS. And this is too important to get wrong. He's absolutely right. I think there is understanding across all sides of the House of the benefits of using anonymised data properly, but it must be done in a way that reassures the public.